Hey everybody, welcome to my channel. I'm Dr. Perkins, a board certified OBGYN, and today we're talking about, can I do exercise during pregnancy? In this video, we will talk about exercises that you can do during pregnancy that are safe and actually really truly encouraged. We'll review exercises that you should absolutely avoid. We'll talk about red flags and what you should do if you experience them. And I'll give you some tips as far as how to safely exercise during pregnancy. I'm going to start today with a myth because there's so many of them and I see them every day. I see them with my patients all the time, and sometimes I've even questioned things myself. And so today's myth is exercise will do harm to my pregnancy, will hurt my pregnancy. And it is actually a myth. It is not true. If anything, movement is medicine. You know, back in the days, we used to say that we would put people on bed rest during pregnancy. We don't do that anymore. We found that the opposite is really true. Movement helps your body, helps your blood flow, helps you grow in pregnancy. Movement and exercise helps your joints maintain their elasticity and their strength and all the good things. And the opposite makes things actually more difficult on your pregnancy. We see more complications, DVTs and blood clots in the legs, and excessive amount of weight gain, and we have fatigue and lack of energy. All the things when we don't exercise and move during your pregnancy. And so we actually encourage that you do. And so no, movement is medicine. It is safe and it is okay. Now, I must say sometimes we can overdo it. And so because of that, we're going to talk about all the things to avoid as well. Outside of the physical benefits of exercising during pregnancy, did you know that exercising also decreases the likelihood of having issues like preeclampsia, which is a hypertension, blood pressure issue during pregnancy, or even gestational diabetes? These are conditions that develop just during your pregnancy and can impact your growing baby as well as your body as well. And exercising actually helps to decrease the likelihood of these things happening. So outside of the physical benefits, internally, you're able to protect your body and your pregnancy as well if you keep moving during your pregnancy. Exercising during pregnancy also helps you to sleep better at night. It helps your mood and your energy, and overall, it helps to reduce the likelihood of you gaining excessive weight during pregnancy as well. So overall, it is absolutely recommended and completely safe. So what do the guidelines actually say? In general, the recommendation is exercising about 150 minutes per week, okay? And that's moderate intensity. That means that we're not like dying and falling over because we can't catch a breath. And it doesn't mean a casual walk, okay? It means that we are having our heart rates up. We are breathing a little bit heavier. We are stressing our body to a certain degree in a good way, causing it to work harder than it typically would. 150 minutes doesn't sound like a lot, or maybe it does. To me, it doesn't sound that much, but you can actually break this up throughout your week. So say you exercise for an hour today and you don't exercise tomorrow and you do another hour the day after, or 30 minutes. As long as for the entire 7-day duration of time, you are totaling about 150 minutes, that is what is recommended. So break it up however you want to. But that's our baseline. And that guideline is the same when you're pregnant or not. So a pregnancy doesn't mean we want to decrease that. We want to continue whatever exercise you've been doing before pregnancy. And if you're new to exercising and the pregnancy is motivating you to do so, you can safely incorporate and start a new exercise regimen with guidance from your provider, as well as a trainer if you have one. And if you don't, you can start with mild exercises and eventually kind of pick up and increase that over time until you get to your 3rd trimester, which at that point we don't want you to have more exercises or do more. We don't want you to work harder. We want you to maintain, or if anything, kind of pull back a little bit and do a little bit less. So here are some safe exercises that you can do during pregnancy. Number 1, walking. Walking is highly encouraged for everyone, and everyone can do it. for the most part. And so walking is great. Walking at a speed that's greater than casual is the best. And walking for long distances. Now, there are some people who may walk for 2 miles a day, 30 minutes a day, an hour per day. Whatever you do, we encourage. But walking is safe. Uphill, downhill, doesn't matter, and it's highly encouraged. Another exercise is swimming. Swimming is amazing on a pregnant body, primarily because the water around you actually help to remove gravity and the pressures on your joints and your hips and your back, and actually helps for you to have a more comfortable movement and exercise practice versus being on land. And so if you like the water, if you like the pools, if you like the beach, and you like to swim, you can absolutely do that during pregnancy. Other exercises that are completely recommended as safe and normal would be Pilates, yoga, engaging in these types of classes. They're completely safe and okay for you to do. Now, I would avoid hot yoga because you don't want to expose your body during pregnancy to high heat of any kind. So this could be the heat from the summer day, this could be from a sauna or hot yoga. We want to avoid those things. But regular yoga, completely safe and okay. Low impact aerobic type of exercises and dance classes are okay as well. I love to dance. If you ever follow my channel, it's just something I've done my whole life. And so dancing during pregnancy is still okay. In general, we just want to safely do that. Again, not being exposed to high heat, making sure that there isn't like any risk to you falling or bumping into someone else. We want to be safe, but low impact, moderate impact, dancing, completely okay as well. Lastly, I'm going to mention strength training because I love the gym. I love some weights. I love lifting, and resistance training is just beautiful hormonally for us and all the things. But during pregnancy, it's also encouraged as well. Sometimes we may need to modify things a little bit. We may need to use more machines versus free weights, or make adjustments based on your growing abdomen. All in all, it can be safely practiced and is highly recommended as well. Now, I've already mentioned not being exposed to high heat, so no hot yoga, but here are some other things that you should avoid while you're exercising during pregnancy. The first is contact sports. We don't want to be bumped, hit. You don't want to be, rolling over and doing things that can cause high forces to go through your abdomen, because this can disrupt a growing pregnancy, and we don't want this. This can also lead to you having pain, back pain, and issues that could completely limit your future pregnancy or the rest of your pregnancy. And so we don't want these things. So no contact sports whatsoever. High impact activities as well. I mentioned that a little bit earlier. We want to avoid these completely. Things like skiing or horseback riding, we want to avoid these types of things as well. Again, fall risk is being increased doing these activities. So we'll do this postpartum, but not during the pregnancy. The last I do want to mention here is, as we are exercising and engaging in all these beautiful activities, try not to engage in activities that will keep you on your back beyond 20 weeks of pregnancy. This is because the growing pregnancy can compress your vessels that are along your spine and can cause less blood flow to your baby and less blood flow to you. And so both of which are not encouraged. Now, here are some red flags. What if you are engaging in these activities, or maybe it's low impact or something very simple, you're walking, but then you start having pain or bleeding or lightheadedness, or feeling like you're going to pass out. These are all red flags that your body needs something else that is different from what you're doing, or whatever you're doing could be causing your body to be in distress. And so we don't want these things. If it does happen, it is okay. Contact your provider right away to let them know what is going on, and they'll guide you. But of course, stop that activity right away. Go to a point of rest. Drink a lot of water and relax while you're calling your doctors and explaining exactly what's going on. And of course, if you are further along during your pregnancy, like in your second or third trimester, and you are keeping up with your fetal movement, if you don't have any of the other types of pains, but your baby isn't moving well or normal for you, do all the things that we encourage, like drinking something sweet, going into a quiet space and resting, and kind of like tapping your tummy and saying, hey baby, you're there. And if you're not getting a good response from your baby, then this is another reason that you should contact your doctors and let them know what's going on. It is important that you modify your exercise activities throughout different trimesters. In your first trimester, you can continue with consistency, listen to your body if you're not too fatigued. You want to continue to lift weights and do all of the things, but listen to your body at the same time. In your second trimester, as your abdomen grows, it is important that you focus on your balance and making sure that you're maintaining a steady gait, especially when you're exercising. And this is because you may not realize initially how your body's changing, and that while last week you were okay squatting in this position, in this angle, now that you're a week later and your baby has grown a bit, your center of gravity has changed, and now your stability isn't quite there doing the same exact exercise as you did last week. And this happens all the time, and it's normal. Welcome it. Just make modifications as you need to. During your third trimester, we are prioritizing comfort. Third trimester can be hard. It's a lot on your body. You're feeling your pregnancy to every degree, and you're probably counting down, waiting for this to be over. During that time, it's important that you support your body, make sure that you are using all the pillows that you need. You reduce the amount of exercise that you're doing to accommodate for that as well. Doesn't necessarily mean to stop exercising, just reduce to a comfort level that works for you. If you're lifting weights, you may decrease your weight by half. Instead of doing 20 reps, you might do 6 to 8 reps. Instead of you working out for an hour, you may work out for 30 minutes. You make modifications as necessary based on how your body feels. Now, one thing that I would encourage during your entire pregnancy is using or practicing Kegels. Kegel exercises can be used at any time. It helps to support and maintain your pelvic floor strength, which helps with laboring and delivering. It helps with the recovery process after you deliver your baby, and that's regardless of whether or not you have a cesarean section versus a vaginal birth. Engaging your pelvic muscles will help with your recovery and help with your delivery process. So we can throw this in and sprinkle it in throughout your first, second, or your third trimesters. I do want to mention that while we are just being overly cautious as we're exercising and we're listening to our bodies, it's also very important that we are mentally accepting the changes of pregnancy and the limitations that happens to your body. I know personally, when I went through my first pregnancy, considering that I exercised very heavily for many years. I was all about the gym every day. We're doing it. We are making goals and loving it, having so much control over our bodies. You realize during pregnancy that you lose some of that control, and that is okay. The important thing to note is that you are biologically changing to support creating a human, which is a huge process. And if you trust the process well, 6, 12, 18 months postpartum, you start feeling like yourself again. Your body will start feeling normal again. No, it does not take 6 weeks. Be patient with your body. Be patient during the process. It takes closer to 18 to 24 months for you to actually get back to a normal place. And so you will get there. You'll be able to engage your core again. You'll be able to exercise and feel normal again. I promise. Now, I'm so glad you were here with us today and listening in. I hope you've learned a few things. If you are pregnant, I hope that you continue to have a beautiful pregnancy, and go ahead, do some exercises if your doctor clears you. I would love to send you a copy of my ebook, Hormones Don't Lie, because we are hormonal and our bodies change all the time. And so for you to get a copy of this, please click the link below, and I will send it off to you right away. Thank you so much for listening in today. Again, I'm Dr. Perkins, and I'll see you next time. Now, if you want to know more and you've enjoyed what we've talked about today, I have another video that I'd like to follow up with that I think will give you lots of information and help answer some more questions that you have. Just click the link below this video and we'll direct you to that. Take care.